Hi, so I'm Denise Klein, and I'm happy to have this opportunity to present work from my lab with hopes of sharing with you some lessons learned from Montreal. So I'm now going to take a moment to load the slide presentation, and I look forward to meeting you online in the question period. The title of my talk is How Experience with Language Shapes Our Brains, Lessons from Montreal. So this is Dr. Brenda Milner on her 100th birthday. And this is a photo of us when I arrived at the Montreal Neuro in the 1990s to join Dr. Milner as a postdoctoral fellow. Now, she's currently thought of as one of the founders of the field of neuropsychology and cognitive neuroscience. And in addition to that, Brenda Milner is also of interest to the theme of this conference in that she shows mental agility even into her 103rd year. In the upcoming slides, you will hear in her own words brief comments about the benefits of bilingualism for healthy aging. So here is Dr. Milner, a happy Montrealer living in 2 languages.
I really like this mix. I'm changing all the time. I go to the grocery store, I'm talking French, I'm going somewhere else. My concierge only speaks English. She's from Nova Scotia. I'm only speaking English. I'm back and forth. This is very good for the brain. You know that. It's been shown. This switching process is very good for your frontal lobes. To me, it's part of the whole richness of life. And to me, because language is very important to me, I don't have many other skills. It's to me very, very important. So that was a huge plus for Montreal.
So today I will take you through some of the themes of the research going on in my lab that relate to work in Montreal, understanding healthy brain organization, and then applying these tools to brain disorders. And I hope that the lessons learned will be of some relevance to the Hong Kong situation. It is my understanding that there are similarities in the rich linguistic context of both Montreal and the Hong Kong environment. And so I hope that there will be themes that can be shared. So I'm interested in how our brains are organized for language in development when you learn 1 language or 2 languages from the beginning, and how the brain might be organized when you learn a language later in life, once there's an already established system. And so for the most part, my work is focused on brain imaging as a window into the living brain to understand brain organization for language. And when I came to Montreal in the 1990s, the work that was happening with brain imaging, the initial work that was out there was done with monolingual, unilingual speakers. It was just the beginning of using brain imaging. And what the study from the USA showed in English speakers, a study by Peterson, was that with very specific cognitive tasks, you could isolate in the brain areas for seeing, where my cursor is, areas for hearing, areas for speaking, and areas for generating. And so this was kind of the first demonstration of being able to see in the healthy living brain how our brains are organized for language. And up until that time, people had been relying on people with stroke or with different types of diseases to try and understand the organization of the brain. Now, I was born in South Africa, where there's a rich linguistic environment, 11 official languages. When I came to Montreal, I realized I'd arrived at an equally interesting linguistic environment. And so my first sort of questions were, how could we use these brain imaging tools to look at brain organization of first and second languages? And so I was interested in using these tools to understand what happens when we learn one language from birth, what happens when we learn two languages from birth, what happens when we learn a language and then another language later in life, how our brains are organized, how are these systems represented. And in the beginning, we had access to PET scans. So this is myself and Dr. Milner with some colleagues developing tasks to be used to ask the question, are the same brain regions involved for first and other languages? How are two languages represented in the brain? So we tried to kind of replicate the Peterson study, but this time looking at more than one language and using a similar paradigm, a block design that was how you did PET scans. And here we had individuals, we had a group of subjects, they were English, French bilinguals, so they were highly proficient. They were English mother tongue, learned French after the age of 5 years. And we got them to perform in the scanner tasks of synonym generation, so generating synonyms in their L1 English or generating synonyms in their L2 French. And what we saw here in this view, you can see on the left side is the left hemisphere, right side is the right hemisphere. If you do the appropriate comparison or subtraction, you can see strong left lateralized activity in the left frontal lobe. And what you see in the second language here was also activation in the caudate, which we didn't make much of at the time, but an area that's also currently thought of as important for switching control of language. Here we saw this activity in the left frontal lobe that is thought to be involved in lexical search and retrieval. And when you subtract the second from the first language, these frontal lobe peaks disappeared, suggesting to us highly overlapping areas for lexical search and retrieval in the two languages. So here you can see in this view here, in this three-dimensional view where we're talking about, this is the back of the brain, this is the front of the brain, the left inferior frontal area important for searching and retrieving from one's internal dictionary. So we thought these are two languages that are highly similar, and in Montreal, where people learn English and French from quite early in life, what about languages that are more distinct? What about languages like Mandarin and English? So here we had students who had come to Canada, to Montreal to study. So they had learned Mandarin this time. Mandarin's the first language, English is the second language. Again, what you see doing a generation task, highly a left lateralized activity in the left frontal lobe, irrespective of the first or the second language, even when languages are quite distinct. And this time, even when languages were learned much later in life, because all of these people learned English as a second language much later and in a much different context from how people had learned English. Again, when you subtract these two, the frontal lobe peak disappears, suggesting common regions for search and retrieval, even in languages that are quite distinct. And my colleague Robert Zatori and Laura Petito showed that this was the same even when you look across modalities, when you look at people who are speaking sign, with sign. This is Quebec Sign Language, this is American Sign Language, again, very strong left frontal activity, and this the same for hearing controls. So irrespective of modality as well, strong left frontal activity for searching and retrieving. And if you look at this comparison here, so this was part of our study, we looked what happens when you retrieve a synonym in your mother tongue. So this is like weep and cry. What happens when you do a search based on phonology? So tactical, practical. And what happens when you make an across-language search? So all of these are within language searches, giving you striking left frontal activity in the front. You can see here the eyes, so really towards the front of the brain, left inferior frontal gyrus. And you see the same idea, so activity in this area, whether you make a within or an across-language search. So here, translation, so people would, for example, be given the word house, and they would say maison, which is house in French. So strikingly similar activity. And when you subtract these, the frontal lobe peak disappears. So again, irrespective of whether the search is based on semantics, phonology, or an across language translation, strong left frontal activity. We see additional activity here in the left basal ganglia, which we thought is involved in the increased articulatory demands in producing the response in the non-native language, because in all of the others, they're articulating in their mother tongue English, but here they're articulating in their second language, French. And we've seen this robust finding of the role of the left basal ganglia in increased articulatory demand many times. So this work that we did was caught the eye of the neurosurgeons because I presented this work, and what they were interested in was that we had shown clear lateralization, that we had shown clear localization, and that we had shown that we could do this irrespective of whether people spoke in their first or second language or were making a cross-language search, because we get patients who don't speak either English or French very well. And so I started to do this work, not only averaging across groups, but to see what happens in a single subject, because I started getting involved in our pre-surgical mapping program to identify language zones in patients who have brain lesions that were going to undergo brain surgery and to protect their speech. And I'm presenting all this work in the context of developing an idea for a language organization in the brain for first and second languages as a way to understand processing in an environment in which there is multicultural and multi-language going on. So this is this work. And we did this, and we looked to see how this would work with fMRI, because PET was starting to emerge as a clumsy technique because you relied on a lot of tools, and that you could maybe do this a little bit more easily for task activation with functional MRI. So we showed in a single subject that you get the same results with PET and with fMRI when they do the same task. And then we started to do these tasks in fMRI with the patient so that they got less exposed to radiation. And we developed a large battery to activate many different regions of the brain, motor cortex, visual language tasks, auditory language tasks. And one task that we find really good is object action naming, because this is language independent. So you can do this in any language. You put the person in the scanner and they see images, and they can do it in any language that they like. Otherwise, you have to develop tasks specifically for the visual and auditory modality of the languages that you're interested in. And this is an example of a patient that we saw who had epilepsy, who was going to have surgery for epileptic seizures. And she was a simultaneous interpreter. She was born speaking Spanish and French, but she learned English to a high level, and she was working in all three languages. And we show that she recruits the same brain region, irrespective of this language that she's searching in. We also worked with patients who don't speak either English or French. For example, we have Indigenous language patients who speak Indigenous languages. So here we tested a patient. We gave them stimuli in English, but they produced the response in Inuktitut. And because we had shown that you could do this in different languages or with translation, that you could still activate the same regions, the surgeon could then clip the aneurysm, and the patient could be treated with success. So we have done many patients this way, activating language zones in relation to different types of brain lesions, and then providing imaging to the surgeon so that they can find the zone of the lesion, the zone of activation, the vessels that are involved to protect the patient, and plan a surgery and discuss the risks to the patient before the operation. So all of this is in the context of combining behavior and the brain to develop an understanding of what happens when we have healthy processes and what happens when these might break down. And we have also looked at other factors that might be important, not only what are the brain regions involved, but how do age of learning impact our brain organization. And we've used task-based activations, resting state fMRI, as well as anatomical tools. So this was a cortical thickness study that we did, where we looked at the difference between the peel surface, which is in the blue and the gray-white boundary, and we measured the distance to measure the cortical thickness with a pipeline developed at the Montreal Neurological Institute. And we had 22 monolinguals and 68 bilinguals, and we wanted to see whether the age of learning impacted anatomical organization. And what we did is we saw that when you compare bilinguals versus monolinguals, there's greater absolute focal cortical thickness in the inferior frontal gyrus for bilinguals compared to monolinguals. But if you break the groups down, what you see is that the late bilinguals have the thickest left frontal cortex. The early bilinguals have a slightly thicker left frontal cortex. So these are people after age 7. These are people between age 3 and 6. But simultaneous bilinguals look no different from monolinguals. There is no significant difference in cortical thickness between those who learn 2 languages from birth compared to those that learn 1 language from birth. And we thought that it's the early organization for language that takes full advantage of the period of greatest neuroplasticity during early childhood. So this is the optimal wiring which would happen. So if you learn 2 languages or 1 language, that you would get the same cortical thickness, because it sort of makes sense that when you wire a room, if you know what you're going to set it up for, it works most optimally. Whereas later, if you want to add something, you sort of have to bulk up a little bit. We've also looked at resting state connectivity, where we've seen that simultaneous bilinguals have stronger interhemispheric connectivity between the left and right inferior frontal gyrus compared to late bilinguals, and that the stronger the functional connectivity between the left and right IFG, the lower the functional activation of the left IFG is required to achieve proficient speech. The connectivity relates to neural resources. We've also shown that simultaneous bilinguals have greater gray matter density than sequential bilinguals in the basal ganglia related to speech articulation, and that in late bilinguals, those who have a better accent have greater gray matter density. So the better the accent, the higher the gray matter density in this region. So these are some of the findings. We have also found that perceiving speech in noise, that simultaneous bilinguals have superior ability to benefit from contextual information than later bilinguals, and a different pattern of neural recruitment in the left inferior frontal gyrus. We have found on cognitive control tasks that simultaneous bilinguals demonstrate stronger anti-correlations between resting state networks and superior cognitive control on assignment tasks compared to sequential bilinguals. So age of language learning, we find, is really important. So there are many factors affecting brain organization. There are the similarity of languages, environments that they learned in, the status of languages, whether they're high status languages or low in a country, time spent using language, types of instruction, age of acquisition, which I think is a really important feature, and different aspects of language. There can be different effects. So we saw that with lexical retrieval, it didn't matter the age of acquisition or the distance of the languages, but some things like articulatory processes are affected by the types of languages or the age of language learning. And there are also individual differences that need to be taken into account. And so in some of the work that we've been looking at individual differences in learning success and failure. And what we've been looking for are neural biomarkers for predicting learning success of language. And so what we've wrapped scans, resting state scans or anatomical scans around individuals undergoing intensive language training programs at McGill University. So these have been all in healthy participants as a first step to understand whether there are biomarkers for predicting learning success. And what we did is we took speech samples. We found that speech samples of our participants were very rich. And we used those to look at changes before and after, and we related them to brain connectivity. And what my student Xiaoqian Chai showed was that on resting state connectivity, if she seeded these two different regions, that seeding the left inferior frontal gyrus, a region I've been showing you a lot, is related to lexical search and retrieval. So if she seeded this, those were stronger connectivity between this region and the left superior temporal gyrus, the greater improvement in the number of unique words produced during L2 spontaneous speech after learning. So the stronger the connectivity, the greater the lexical retrieval improvement in this group of individuals. And then she showed that in a different group of individuals, those with stronger connectivity between the left visual word form area, a different part of the left hemisphere, and a different part of the left superior temporal gyrus, these individuals showed greater reading speed improvement, words per minute. So here we're looking at, essentially, if people tell you that they feel they have different aptitudes or different learning styles, they may in fact be correct, that there are different patterns of connectivity, and that it's not the same individuals that show different, these ones that are better visually or on reading are different from those that are better at the auditory lexical search and retrieval. So this was a resting state connectivity study. We have also been looking at diffusion, white matter tractography. This is new data, so it's just in the process of coming out, but we looked at differences between two different anatomical tracts, and we isolated them in different individuals. And what we looked for was we showed that this tract here, the yellow tract, was more related to articulatory improvement, whereas the red tract was more related to lexical retrieval improvement. And what we also showed, we had two different groups of participants, was that it was universal, that there was no difference in individuals who spoke two languages and learned a third compared to, so these were Mandarin English learning French, and this was English learning French, that those with stronger connectivity between these two regions showed greater articulatory improvement from time 1 to time 2 on a spontaneous speech sample, and those with stronger connectivity between these two regions had greater lexical retrieval improvement from time 1 to time 2. So what we had been interested in was that speech samples in these studies of healthy volunteers had provided very rich sources of information. And although I've been interested in brain imaging all my life, I have really realized that behavior is the feature that a lot of patients present with as their first presenting symptom, and that a very cheap and very easy way of trying to identify problems with behavior can be found in speech samples. And in a study that was done looking at nuns, what's interesting about the study was that it's very easy to control in nuns many features that are not controlled in the rest of the population. They eat the same meals. If they're living together, they have the same sleeping schedule. They have the same activities, the same amount of exercise, the same backgrounds. And what they did is they looked at all these nuns who were living together, and what they found was that their language, their written text, when they came into the convent, that those predicted who would develop dementia decades later. So those who showed superior language skills in their early 20s protected from dementia many decades later. And what they also found after reviewing the material was that those nuns who spoke 4 or more languages, only 6% of those developed dementia compared to 31% who spoke only 1 language. Now, there's a lot of discussion about the benefits of bilingualism for the offset of dementia, and my work doesn't address that directly. But what I am going to tell you is that how we are looking at speech samples to predict the onset of dementia, and how we're taking into account bilingual environments as one important feature of understanding the speech signal. So I got interested in speech samples because I was listening to the radio one day and I heard this intriguing study where they showed that Muhammad Ali's slowing speech was evident when he was at the height of his career. And so they had studied his speech samples, and they showed that there were differences in his vowel space and slowed speaking rate long before the disease manifested itself. And at the same time, many people, not only myself, had been starting to think about how we could use machine learning algorithms and artificial intelligence together with speech samples to understand resilience and disease. And so we are interested in speech samples because we speak from birth to aging. So there's a rich and long history of speaking in most individuals. What we see is that although there's decline in cognition in aging, verbal ability, the black line, usually remains quite intact. And so this is something that's easy to then work with and monitor. So we're interested in the speech signal, which we find is a rich source of information. We're interested not only in the signal itself, but in relating it to patterns in the brain. So some of that work that I had done on biomarkers, we're interested in relating changes in speech with changes that are taking place in the brain in individuals, and to use this to calculate risk for disease. So in the same way as you might be able to calculate risk of heart disease by keying in to a program, risk factors, here we could develop some features that might allow somebody to start to detect differences in speech. And so there are many people who are using these models to predict the onset of Alzheimer's disease, dementia. A lot of people are using the cookie theft picture. A lot of people are using the voice and technology to understand disease. What we have the opportunity at the Montreal Neurological Institute is to look beyond the speech sample and relate it to treatments, genetics, to imaging, so that we can see in individuals, even in individuals before the onset, family members, how their speech might predict the onset of different diseases. And here is just to show you anecdotally, we've seen about 150 patients. We've also seen some controls. So anecdotally, we do more than the cookie theft picture. We look at reading. So everybody's doing the same sample. We have the cookie theft picture. We have autobiographical memory. We have phonation. So this is an example of a control, reading and their autobiographical memory. And then just to show you a patient as an example, the patient's reading is a bit more monotone than the control. But where you really see a difference here is in the autobiographical memory, where the control has a lot of nuance and flatter speech for the patient with autobiographical memory. But what we're trying to do is we're trying to train an algorithm to detect differences in speech samples. So here's an example. We give the algorithm 150 healthy participants, and we tell we indicate which are young and which are old speakers, and then we give a new untrained set, and the machine is able to detect with a high degree of accuracy young from old speakers. We can look at the relationship of speech samples to neuropsychological variables. So here, fluid cognition, where young have better fluid cognition than old. Crystallized cognition, where old have slightly better crystallized cognition than young, and to features where old and young people don't differ, personality variables like introversion and extroversion. And we can see how speech samples relate to these features. And what you can see is that the measures, the speech samples are able to discriminate or be related to these features. So we've been working with healthy volunteers to try and train the algorithms to do that. We are looking at different features of the voice, articulation, and prosody with patients and controls to try and see if we can detect differences at the group level. Ultimately, eventually, one wants to detect these differences at the individual level. We have tried to look in relation to disease severity, so not a patient compared to a control, but how, for example, their speech sample relates to a UPDRS score, so the Parkinson's disease rating scale, because that characterizes the extent and the burden of the disease. So our samples, how they relate to severity of the speech, of the motor, speech motor symptoms, and linking speech samples with that. We are also relating them to things like the MoCA, the cognitive assessment. What we are seeing is that it's an additive effect. So there's a combined effect of impairment and the UPDRS score. So those people who have a cognitively normal MoCA don't, they don't seem to be as affected as those who have the combined effect of both. So speech is worse in the patients with cognitive and motor deficits. So these are all new data, not very well explored, just anecdotal, really just trying to show you what we're trying to do. And then the challenge of cross-cultural dementia diagnosis. We have been getting people to rate, and we are getting the computer to rate things like voice, articulation, and prosody, whether it's normal or monotonous. These are examples of how it could be different in different individuals. You could have a normal voice, but a slurred articulation and normal prosody, or you could have a bit of a breathy or harsh voice, but normal articulation and normal prosody. So these are things that we're trying to distinguish, but we also want to quantify speech variability that's unrelated to things like accent. We have many people who are speaking in a second language, and we believe that the algorithms also need to distinguish this from more subtle disease-related changes. So we are working on features of accent, of second language learning to integrate these into our models for detection of disease. So the goal is to take speech samples to identify differences about speakers based on many different features, to relate this to the brain, to how the speech samples change with treatments, how it changes with genetics. Two people with the same speech samples might have different genetic profiles, or two people with the same genetic profile might have different samples. So how these samples change with all these elements. We're relating this to the Quebec Parkinson's Network, to the Canadian Consortium for Neurodegeneration in Aging. And we want a disease agnostic approach in the end. So we want to be able to have somebody come in with a complaint that something's changing, word finding difficulties. So there's a common presentation. And so early on, when people are unsure what's happening, to have some sort of method where we could use speech samples to differentiate whether this might be more of a dementia of the Parkinson's type or of the Alzheimer's type, or what might be affecting, what might differentiate these speakers. So this is Brenda Milner on her at her centennial symposium held in honor of her 100th birthday. She is the founder of the field, and she's also an amazing example of cognitive reserve and resilience, and an outstanding ambassador for major themes of this conference. And she speaks English, French, a little bit of German, very fluent also in Italian. And I thought that we would play a snippet of her presentation, of her speaking at her centennial symposium.
For me, I'm a little overwhelmed and very rarely at a loss for words, as I think those of you who know me realize. But tous ces éloges, you know, one after the other, je ne me reconnais plus. I am, I think, proud of having brought psychology and neurology and neurosurgery much closer, you know, as I think somebody mentioned earlier, I was told by my supervisor, Donald Head, that no psychologist could survive for long at the Montreal Neurological Institute, you know, that it was essentially a medical stronghold, that Penfield really welcomed people for a short time to do an interesting piece of research on his patients. But after, you know, you went your way. And somehow I found this environment so enticing. I was very happy teaching at the Université de Montréal. I crossed this mountain. I always loved French, and it's l'Université de Montréal qui m'a accepté, qui m'a accueilli. C'est pas l'Université McGill quand je suis venue ici.
So based on our experience in Montreal, being bilingual produces more than smiles. There are benefits on the brain, and we know that the brain does organize differently based on experience. And clearly a multilingual environment dictates the questions and needs of our research. My work over time has been to understand the healthy and diseased brain and to integrate a bilingual perspective. I hope that some of the ideas that I've presented can be integrated into discussions during this conference to advance our understanding of healthy aging and neurodegenerative disorders and the factors that might influence cognitive reserve and resilience. So thank you very much, and I look forward to questions. These are my students. Many of them have contributed to the work that I presented today. In particular, Peter Donhauser is working on the speech samples. Xiaochen Chai is the person who worked on biomarkers, and many of the other students have contributed to the studies that I mentioned today. Many thanks.